I'm Dr. Hansen, and today we're going to be talking about Restylane. Restylane is a group of products called dermal fillers. Dermal fillers are what is adding volume back into the face. Where do I like to use Restylane? My two favorite areas, believe it or not, are actually in the tear troughs. And one of the reasons I like it in the tear troughs is because it doesn't draw too much water to it. Other products will actually draw too much water to them, and then you can look puffy underneath here, which gives you that done look, and it does not look natural. So Restylane won't do that for us. So when we're using Restylane in the tear troughs, we're actually going to use a 1/2 to 1.5 syringes per side. If I've got somebody who's a little bit deeper in their tear troughs, I'm going to quite often do 1 syringe per side. And then we're going to see them back anywhere from 1 to 3 months later and do just a little bit of a touch-up. Because as soon as you start working in the tear troughs, you actually can get a little bit of swelling. And along with that swelling, I can't see what I need to inject and where I need to work. When I inject this in the tear troughs, I'm actually going to be using what's called a cannula. A cannula is not a needle. It's actually blunt on the end, which makes it much, much safer than using a needle to inject these areas. A lot of people still use a needle, which is the wrong way to do it. The cannula also decreases the amount of bruising that you're going to get. So that's one of my favorite areas, but also I like to use it on the nose, especially when I'm doing it for the very first time on somebody, so that we can look to see what kind of shape that we're going to get, so that if we really didn't like it, we can actually dissolve the Restylane and make it go away, or if we have a complication from it, we can actually do the same. Using Restylane on the nose is actually going to take 1 to 2 sessions, and we're going to use part of a syringe each time, so we can actually correct bumps in the nose, as well as we can round out the tip of the nose, get rid of the appearance of some of the cartilage, as well as we can actually correct what appears to be a curved nose. So if you're interested in looking further at working on the tear troughs, or actually a non-surgical rhinoplasty using Restylane, please call us at the clinic for your free consultation.